Okay, good morning, everyone.
Morning,
Um,
Mike. Morning,
thank
June.
morning.
Morning,
Um,
everyone.
we've got a new face on the screen today, or a new face to some anyway. We've got June Brown, who is the Nursing, Midwifery and Allied Health Professionals Director. I think that might be your right title, is it, June?
Well, actually, my right title, Mike, is Executive Nurse Director, but I do professionally support nurses, midwives, allied health professionals, and psychologists.
Well, thank you very much, and thanks for joining us today. We're really grateful for that because, as I said previously, we've had an awful lot of questions recently, and we were aware that quite a few of them were NMAP related, and we thought it might be really good to have you on screen just to give some more definitive answers. So that's really helpful. Caroline, is there anything you want to add before we get started, or do you want me just to crack on with the questions today? Because I'm aware we've got a few.
I'm just delighted that June's here, and I'm feeling really chilled. I'm sure June's not feeling really chilled, but I'm feeling really chilled because she's going to get all the questions. And yeah, I think just to thank June for coming along to do this and recognise that we're trying to make these sessions as meaningful as possible. So clearly, having someone on the call that can answer the questions is much better than not. So June, looking forward to the session. So thanks.
Okie dokie. The first thing I was going to ask you, and it's not strictly a question, it's just a theme that we've seen in the Q&A sessions over the last couple of months since it was first brought up. And there's been an awful lot of interest from healthcare support worker colleagues about potential rebanding and changes to roles, I think particularly around the grade 2 and 3 roles. Is there any sort of update? One thing people are always keen for is a timeline or some sort of sense of how long that's going to take. Is there anything you can talk about before we get started on that?
Yeah, no problem at all, Mike. So the healthcare support worker roles, as many will know, that SACT, which is Scottish Government direction in relation to looking at the Band 2 and Band 3 roles, took place earlier in the year. We have got a short life working group here in Grampian set up, which I chair, and we have lots of partnership support from our colleagues across the organisation. And we have also managers, and we've got some healthcare support workers, etc., on that group. So we've got quite a range of people contributing to how we're going to do this. So we've been set up. I think this is probably our third or fourth meeting. We're due to meet next week again. We have got a plan in action now, so we've got a process that we're going to follow to ensure that we look at people's job descriptions if they're a band 2 and see if they would wish to be seen as a band 3, and what that process looks like. It's been built up, and what we're doing just now is looking at job descriptions and developing a band 2 and a band 3 job description for the future, taking that forward. So there's a bit of work to be done with line managers and their staff once we've got this process finalised and put out, and that bit of work will do that identification of what needs to be the next steps for each individual, and we'll take it forward from there. So timeline, I would like this to be done as quickly as possible so that people know where they're at. Absolutely. It's just getting it right, because we don't want people to get stuck in holes and problems being developed when they get to that conversation with their line manager about what they want to do. So it's just making it really clear and ensure that everybody's on the same page. So I'm saying by October time, I'm hoping that most people will have had that conversation.
Yeah, that's really helpful. And I know there's always a reluctance to put firm timelines on things, but I'm grateful, and I'm sure everyone else will be, for giving a rough indication. Just don't hold June to it because it's very flexible. But thank you for doing that.
Mike, can I just
Um,
Mike, can
yeah,
I just ask June a couple of things, just because I think it would be helpful seeing the kind of themes of things that come through. So, June, if colleagues are interested when they hear what you've just said, how could they get sight of the action plan, or how, because there's so many healthcare support workers in our system, it's really difficult to communicate with everyone. So, what would be a good way after next week's meeting or after every meeting, just to give a way of an update? Do you think the daily brief, or what would
Uh,
work?
Yeah, I think Yeah, I think, in fact, we had a bit in I didn't chair the last meeting, but there was a discussion about how we're going to communicate. So I think using the brief will be an ideal way of doing that. So
Okay.
we can just do a little update, timelines, because the plan's there, and just where we're at, so that people know where, and have a better understanding. And they can speak to the partnership reps as well if they want any more information or they're a bit confused by it. We can also get them to support them.
Great.
Okay, thank you. Okay, so I'll just crack on with the submitted questions. I'll just open it up to, if it's directed at Caroline, I'll maybe come to Caroline first and then come to you, June, but generally whoever feels best placed, just jump in and we'll see how it goes. The first question is anonymous. They ask if you can tell us what the current safe staffing levels are for acute wards. They mentioned there are many shifts where there is one registered nurse for far too many patients. They've mentioned examples of one registered nurse to 19 patients. They feel that's unsafe, unfair to put pressure like that on the nursing staff, on patients. And they feel that when they highlight the issues around this, that they feel they're ignored and no action's taken. June, is that one that would come to you for?
Oh, absolutely. So yeah, so Mike, I think things have been really challenging over the last while. Staff sickness has contributed to us at times having some issues with our registered nurse workforce across the whole organisation. 1 to 19 is not what we would want to be at all. At the moment, we're generally working at 1 to 8. However, we're trying to get back to 1 to 6 in acute wards. Obviously, we've got workforce tools, etc., that tell us how many staff, given the acuity of our patients. We have those, and we'll start to build and work on those as we move forward to really understand what's going on, because a lot of things have changed during the last 2 years of COVID. Wards have changed, patient acuity has changed, that kind of thing. So there's a major piece of work needs to be done to really understand the workforce. But I would say 1 to 19 wouldn't be acceptable. On a regular basis, it will have to have happened now and again, and we should be detecting that. We should be saying that our staffing levels, it should be getting raised with the nurse manager who's in charge, that's out of hours or whatever. We should be highlighting to them. There will be, I know because I've been out and worked with the nurse managers on that late shift to understand what it's like trying to equalise staff across the whole organisation, across ARI, so that we've got safety across the whole place. So if you, as a registrant, you should be raising your concerns with your line manager. You should be detecting it that it's not safe. And we have priorities of care in place. If people are in that position, knowing that they don't need to do everything, they should be using the priorities of care guidance.
Anything you wanted to add on that?
So I think June clearly knows this at, I would suggest, at a granular level. And so the only things that I would add would be to concur with June that in particular the past couple of years have been incredibly difficult, and we're hugely grateful to colleagues that have continued to deliver the care, the best care they can with what they have. I would agree with June. One registered nurse to 19, I from the data that I look at, would be a very rare occurrence, and if it's not, we need to understand why we don't understand that. And as June said, very clearly now looking to learn from COVID, but also on a national, might be interesting for colleagues to know that the Health and Care Staffing Bill, which has kind of been pretty static for the past couple of years because of the pandemic, is now back up, and there's a clear focus on it. So I know that June and colleagues, all of us, because this isn't just about nursing workforce, although this question is for all colleagues, which the bill covers, then there will be a real focus on that. So it is definitely not being ignored. It's something that we talk about in the exec team definitely every week, if not several times a week.
Okay, thank you. The next question comes from one of our colleagues in the maternity hospital. She says, her name's Susie. She works in the maternity hospital as a maternity care assistant and mentions that she lives on the other side of Aberdeen in Lawrence Kirk. She says she works 3 12-hour shifts a week and lives on her own. And with the rising cost of fuel now an issue alongside the general cost of living increases, she wonders and worries what will happen if there becomes a time where it's too expensive to go to work. Caroline, she's asked if you're aware of anything else that's in the pipeline to assist NHS staff who are feeling the pressure of the cost of living crisis.
Thanks, Mike, and Susie. Thanks for reaching out. I think that what you describe is I'm hearing it so many times, not just through these Q&As, but in other conversations, and you're absolutely not alone in trying to balance living costs with everything else. So I am, as other colleagues are, watching this really, really carefully, nationally and locally. What I am seeing, which is usually how I work through when we need to do things with colleagues, is around the number of times or the concerns that are being raised. So at the moment, what we're doing is absolutely making sure that when concerns are raised by colleagues about being able to do their work, and you'll have heard a couple of them in regards to travel costs not meeting the needs anymore, or previous conversations about uniforms and blouses and not being. Actually, it's not all about cost, also about climate sustainability. But and so we're working through these things on an individual basis as they're raised. However, I would agree that for a number of colleagues, actually getting to work may become very challenging. And so what I have been thinking about and discussing with some colleagues is making sure that we have a contact point for colleagues to raise their concerns and to be able to say, look, I'm really struggling. I can't afford the fuel to come to work. To be able to signpost to things easily for financial support. So my suggestion to Susie is, if she's comfortable to do so, to discuss that with her line manager. And what I'm going to do this week is speak to Tom, our Director of People and Culture, just to make sure that there's a regular update coming through the HR hub when colleagues are contacting the HR hub, which is what I would suggest, that Susie does. So line manager or HR hub, and what we need to craft is a kind of a list of Q&As about how people can get additional financial support. We could actually put that in the daily brief. I think, Mike, that might be a good thing to do. So a number of actions. So Susie, I think this has happened to many, many people. Please speak to your line manager if that does become a reality, because we just can't have people not being able to afford to get to work, and we need to find ways to deal with that. The solutions won't all sit within health, clearly, but I'm sure there are many agencies that can support this. We should do a Q&A, because this is not the first time this, and it won't be the last time this comes up. And I would like the HR hub just to have a specific kind of place for people to go if they're not comfortable, because obviously people will have different views on this. If they're not comfortable to speak to their line manager, then to speak to HR and get signposted. And I'm just keeping a really watchful eye on this in regards to the impact.
Okay, thank you, Caroline. I'll just move on to the next question, which is again an anonymous one. They mention that they feel there needs to be more of an incentive for people to do shifts on the NHS nurse bank. Their suggestion to do, one of the ways to do that would be weekly pay. Currently, they say they don't get paid for their shifts until the end of the following month, and they feel that the weekly pay would make a difference. June, do you want to address that one to start with?
Yeah, it's a really topical question. I'm laughing and Caroline's laughing because it's only a few days ago that we had this conversation. So I was raising with Caroline, and in fact, it was part of a meeting where we were looking at plan for the future. And I felt that one of the things we should try and do this year was have people on the bank paid weekly, given the cost of living crisis that we're experiencing. So that's my personal view on it. I will, as I say, I was definitely trying to advocate for that, but I'll hand over to Caroline.
Oh, that was a definite dodge, June. So I think June's absolutely right. And the reason I'm smiling is because I remember having this conversation when I was the nurse director. So I think that it's definitely it's not as straightforward as I thought it was. However, June put forward a very valid case last week, and what we're doing just now with Plan for the Future, Mike, is we are setting our executive team's objectives, and I'm really encouraging us to be really small in the number, but actually we're going to deliver on it. And June was advocating exactly what we've just discussed, that one of those would be around we will move to weekly payment for colleagues who support and work on the bank, and of course, if that's their choice, we would have to offer that as a choice. So I think that there's some work to do to understand what that is, and happy to come back with a further update. But to be honest, I think June's case in regards to cost of living and why people sometimes are motivated to pick up bank shifts, I think is really valid. So watch this space. And we'll get back to you really quickly.
Perfect, thank you. The next question is anonymous. They ask if there are any plans to make extra training available to healthcare support workers who are on the bank. There were band 3 positions for working at hubs, apparently, that you need to have skills for bloods, ECGs, observations. But the member of staff mentions they were told that they needed to have training that wasn't available to band 2s. Is that something that you're aware of, June? I hope that makes sense.
Yeah, no, it does make sense. And this is a healthcare support worker on the bank.
Yes.
Did you say that, Mike? Yeah, okay. Yeah, so that training's available to anyone. It's via TURAS, and people would be able to log on and get that. We absolutely need well-trained, highly skilled healthcare support workers here in NHS Grampian, and not for 1 second would I not want people to have access to that level of education, that they can progress their careers and have that opportunity to have that development. So I would suggest they have, if they're on the bank, they will have a manager on the bank aligned to their TURAS, have a conversation with them, and they will be able to access the education from there and get booked onto anything they would want to be booked onto. The other thing I would suggest is if they are going for, really interested in jobs like that they have a call with the person who's advertising the post and explain that they don't have that skill set, but they're really keen to get it, because I'm very sure that those line managers and those managers would be really welcoming that conversation and be willing to support them to go through that education as well. So because you don't have the skills at that point in time, don't let that put you off applying for a job. Okay. To whoever anonymous was.
Okay, the next question is directed at Caroline, but I think it's probably one that you both might want to come in on. The person who is again anonymous asks if Caroline is aware that school nurses in NHS Forth Valley have apparently been rebanded as Band 7 due to the complexity of the child protection workload and some other responsibilities. They've asked if we're aware whether there's any reevaluation on the agenda for NHS Grampian. I don't know who wants to come in first on that one.
So I'm happy to kick off by just saying no, I'm not aware of that at all, actually. I'm sure June will have more information perhaps, but no, the only reason I was coming in was just to say I absolutely recognise the critical role that our school nurses play, and in particular, the you've highlighted the child protection role, but it's much broader than that, and the role is getting broader and broader in regards to supporting the well-being of our children. So I don't know anything about regrading, but June, do you want to jump in?
Yeah, so I know nationally there was a board that were looking at it, but I didn't know the outcome. Mike, I'm happy to take this away and work with Jenny Gibb as the nurse director for the Health and Social Care Partnerships and the three lead and chief nurses in relation to it and understand more about it. And maybe we'll do some communication to school nurses following that if that seems an acceptable way forward. I don't have the fine detail that I can provide any information.
No, that sounds really helpful. Thank you, June. So the next question, it's slightly longer, but if you bear with me just as I ask it, it's someone mentions, Caroline, that in your video messages and in the learning and development policy document, you emphasised the support for NHS Grampian employees that want to continue with professional development and to undertake career path change within this organisation. This person feels that unfortunately some people are regularly refused study days by managers, or they're just given one study day a month or even every 6 months. She mentions obviously you had studied towards a doctoral degree yourself, and hopes you would agree that one study day every 6 months isn't enough. They go on to ask that what your advice would be for those that are prevented or feel they're prevented from developing by these limitations.
Thanks, Mike. And I'll kick off, but then June could maybe pick this up around. Did you say, Mike, the professional background of this individual?
No, they don't actually say. I
Okay,
believe it was a member of nursing staff, but
okay. I think it'd be good to hear from June anyway on it, because nurses do make up the largest part of our workforce, so I'm sure it will have relevance. So I think that this is a really tricky one, and in fact, this is another thing that we discussed. We have a meeting once a month with a broad range, around about 100 leaders across the system in NHS Grampian, and the topic of debate discussion this week was statutory and mandatory training and the variation across the organisation in regards to how different teams deal with that. Some teams get protected time, and some teams have to do it in their own time. Some teams don't do it, and a broad range. So at a really strategic and high level, Mike, I think we need to prioritise education and development as much as healthcare delivery in our organisation. I think people very much see us as a provider of health and care, but actually we're a provider of development and education as well. Now, that there's a formal function around that. So, for example, for universities and colleges that place their students here, so an undergraduate type of role and function, but there's also a postgraduate role and function as well. So, as part of the plan for the future, developing our colleagues is a key part of that. And I think for managers, it's incredibly difficult, because I think if you were to speak to any manager, do you think developing your colleagues, your team is really important? I would imagine the answer I would get is absolutely. And when it comes to you've got one member of staff because two are off sick and two are on leave, and you've got to provide a service, are you going to cancel somebody's education? Probably, absolutely. So I think there is something about the number of colleagues we have in our system. So we know we're challenged with vacancies, although that's pretty static and not in all areas. How we plan and prioritise and protect time for education, I think, is a big thing. So in the plan for the future and in this year, I would really like to be able to describe how we are going to move forward culturally, with our practice, with systems and processes to actually say, look, we're going to take this really seriously and create space for education. That'll be easier in some areas than others, but we have to start somewhere. And so from an intent perspective, absolutely that is the intent. And I think as we understand what gets in the way of it, we'll need to deal with it. We're not going to fix this in 1 year or even 2 years, but I am confident that I want to. I'm confident because I know everybody that I speak to wants to prioritise education. How we're going to do that is the important question. And June will have some thoughts on that, because obviously one of the biggest workforces are nursing, and one of the workforces that I hear most frequently from cannot be released to take a tea break, let alone have some education, are our nursing colleagues. So June, I would really welcome your thoughts on that. Don't expect you to have the answers.
Yeah, Caroline, I certainly don't have the answers, but it was making me reflect on the earlier question about the one registered nurse to 19 patients, and fully understanding why people's study leave would be cancelled. And I suppose we've got our policy, and thinking about people who are doing post-graduation or post-registration qualifications. And when that commences, they would enter into a learning contract with their manager and probably the educator for their area to look at what somebody's expectations and responsibilities around supporting that person through their education. And I think it's really important that people take the time to do that and use that learning contract. So that then binds the manager in and the individual into understanding what expected of them in relation to time being released, etc. And building that in. So I would just say that from that perspective, nursing is the biggest workforce, and there is a real need to ensure that we support our nurses, midwives, AHPs and our psychologists, all to maintain their education and development, and trying to do that and balance it with service is really, really difficult.
Okay, thank you. The next question, again, it's anonymous, but it's from a colleague. I'm assuming it's a nursing member of staff, but they're concerned about the consistency of nursing uniform across NHS Grampian. They mention a number of examples. For example, in specialist nurses in public health, apparently at Band 8 are wearing maroon uniforms, but Band 7s wear navy, yet in ARI, all specialist nurses wear the cornflower blue, irrelevant of their band, and they've highlighted a few other examples. They've asked if there's anything that can be done to ensure better consistency across the organisation. Is that one for you, June?
Okay, it would have been one of Caroline's old ones, but definitely one for me today. So yeah, and interestingly, the nurse directors have been having a bit of discussion around this recently, because the nurse consultants and specialist nurses are keen to have individual uniforms. So and maybe what we need to do is put this communication back out again. So in Grampian, the people who wear the smoke berry, which is kind of burgundy colour uniform, are the clinical leaders, the clinical leadership people, nurse managers. Who else would be in that? Chief nurses, lead nurses, they would wear that uniform. It wouldn't be the nurse consultants. They may be paid a similar grade, but the uniform's there to show the leadership and the clinical leadership, so they wouldn't be wearing that uniform. In relation to navy blue, which is the senior charge nurse uniform, which came out in the same time as Leading Better Care, when we did the work to really emphasise and support the role of the senior charge nurse and charge midwife within practice, so that the public could identify who they were, so that they could go to them and ask the question about their individual loved one that they've got in the ward, or get some support. And also the team leaders, so community team leaders would also wear a navy blue uniform. But other than that, these are the only people who should wear a navy blue uniform. To wear a Band 7, it doesn't mean that you wear a navy blue uniform. So everyone else will wear a cornflower blue uniform. What I can say nationally is, so we just had our Scottish Executive Nurse Director meeting on Friday, and we were having a discussion in relation to to ANPs, Advanced Nurse Practitioners, and what uniform they should wear to identify them as it's having a different skill set, if you like, and the care that they can provide. And there has been quite an extensive research piece of work done looking at the evidence and trying to decide the way forward. So that work is progressing, but also agreement at SEND was that work would also be done for clinical nurse specialists so that we can look at that. Changing uniforms is not something we do locally, it's a national thing. So as part of SEND, as we're called, the Scottish Executive Nurse Group, Directors Group, if we want to make a change, we need to speak to other departments in Scottish Government to allow that to happen. We can't make that decision by ourselves. We need to speak to workforce and various other places to ensure that happens. So it's actually quite complex, to be honest. But what I'll do from that question to the anonymous person is I'll restate the guidance in relation to uniforms. That's a long-winded answer, Mike, sorry.
No, that's absolutely fine, and it helps provide some clarity, and I think it probably comes back to that thing a little bit where we've got the terrible habit in the NHS of defining people by their pay band, which, as you're saying, the uniform's to do with the role rather than, Is there anything you wanted to add on that, Caroline?
Absolutely nothing.
Fair enough. Okay, I will move on to the next one. It comes again anonymous. I think a lot of our nursing staff like to be anonymous. That's a theme from the Q&A. A question on behalf of a number of anonymous colleagues in the Anchor Day Case unit. They mentioned that currently staff nurses on Band 5 have to undertake additional training through a university course to become competent in systematic anti-cancer therapy. After completion of the course, the staff nurses remain at Band 5. They'd like to ask why this doesn't come with a progression to Band 6, and as this role is then classed as a specialty, and asks if that's something that could be considered. I think that's quite similar to one of the previous questions we had about the specialist roles and regrading. Who would like to come in on that one first?
I'm happy just to give June a bit of thinking space if she needs that. And I think I am aware of the university programme and I'm aware because of the work that Yvonne Wright did in making sure that our colleagues had access to the right academic support and education to fulfil their chemotherapy function at a really high standard. So I'm really, really pleased that from the tone of that question, that's robust, it's in place. And obviously there's an opportunity in the transition to the anchor and what we know is an absolute increasing demand on these colleagues, and it's highly specialist. But I also know that doing an academic course doesn't translate into additional pay. It's about competencies and roles. But I know, June, you're really thoughtful about redesigning and reskill mixing our workforce for sustainability and to make sure that we're delivering really high quality care. So I would imagine there are opportunities for that reflection with these teams on what does the service need.
Yeah, thanks, Caroline, and not familiar with this issue either. So I think it's back to a conversation with probably Yvonne in relation to that, and she will have a greater understanding of the skill set required at that grade, etc. And just looking at our processes that we have in place, our job evaluation HR processes, and just visiting them to see if they apply in this scenario or not. And thinking about as we move forward with redesign of our workforce, what opportunities there would be there to look at these roles.
Okay, thank you. The next question, again anonymous, from an advanced nurse practitioner colleague. It's about postgraduate funding. They mentioned that at present newly graduated nurses can apply to have full postgraduate master's courses funded. However, experienced nurses can only apply for some help with the funding and have only received 50% of their course. They would like to ask why that's the case and whether we consider putting in place a level playing field for all funding applications, particularly in the context of the cost of living crisis. Is that one that you'd like to come in on, June?
Okay, let me just try and answer this one. Let me think about it. So newly graduated nurses have the opportunity to, not all of them, I think it's about 20, to do a PG cert, which is 100% funded. So that's only the first part of a master's degree. It's not a full master's degree they're fully funded for. It's only for the first part. And this came in the back of the clinical academic careers work that we'd done some time ago. And it's really trying to boost people into a clinical academic career at that point in time. So that's the rationale for that support and that 100% funding for the certificate. So when people who are not newly graduated nurses are applying, they are applying for their whole masters and getting 50%. So if you like, it kind of equals itself out. So the newly graduated nurse, after, my understanding is, and I may be wrong, but my current understanding is that after their certificate, they would need to be applying to progress with that, either using the postgraduate funding where they would only get 50%, or they need to do it by themselves. So they don't get 100% for their whole MSc, is my understanding, if they choose to progress. And any other registrant can apply to the postgraduate funding for the support for their whole master's programme. So I'm not sure if there is an inequity. If there is, it's just very slight, but the purpose of it really was to progress people into clinical academic careers and continue that through their career and really build up the amount of people that we have and a whole workforce around having that skill set to be able to really use evidence in practice.
Okay.
Don't know if that answers the question or not, but
Mike,
Caroline, do you want to come in? I think it does. There's obviously, it's a complicated thing and it's not easy to do briefly, but is there anything you want to come in on, Caroline?
Yeah. So, June, I think it does answer the question. One of the things, so you and I have both had the support to do postgraduate education, and I, for one, know if I hadn't been fully funded, I couldn't have afforded to do it. However, that was through multiple different funding sources. So I'm just wondering, is there a kind of Q&A or a something that can guide people to charities, to endowments processes, to the different avenues? Because what again I know is, if there is any way we can fund things, then we will. But so we've got the kind of formal 50% that you've just described, but on top of that, because we know in regards to our intent around equity and that there is a risk if we don't create those opportunities, then that there will be a community in our workforce that can't access postgraduate education because they can't afford it. And so there is something for me in just what we're discussing about. So if I completely understand June's position on the 50% piece, but what are the other options? Because we have endowments, we have charities, we have lots of other options. Does that Q&A already exist, June?
So we certainly put it out last year. I need to double check with Jane Ewan for this year. But so if I cast my mind back to my clinical doctorate, the organisation didn't fund it for me. I self-funded, and I got a scholarship from the Florence Nightingale Foundation for some of it. So I think everybody has a different experience, but there are places like the Florence Nightingale Foundation scholarship. There's some money that comes out from NES and a general nursing council bursary. So there's endowment. So there's various ways we could do it. Now we definitely did that last year, and I'll just double check that we've done it and ensure that that's communicated out.
Great.
Okay, I'm conscious time's moving on. Do you guys have time for one final question? Hopefully. Thank you. Okay, this one comes from a colleague who, I think it's originally obviously directed at Caroline. They ask about how you feel about the number of managers in NHS Grampian who do not have nursing experience. The colleague feels that the staffing levels, skill mix and wastage of resources would all be improved if there was more managers with nursing backgrounds. they basically say that they feel that the future looks bleaker over the next, given what we've just been through over the next 2 years. And I've asked Caroline whether you feel more nurses with a nursing, more managers with a nursing background would be beneficial to NHS Grampian and less wasteful of funding.
Gosh, what an interesting question to end on. So I think that nurses make excellent managers, and I also think that other professionals make excellent managers. And so for me, it's about the skill set that individuals have, and managing, and I'm separating out management and leadership. So there are some very technical and professional requirements to be able to do a managerial position well. And I believe that all of our colleagues, be they managers or be they leaders, in fact, the leadership values and behaviours should be consistent. So if I separate out leadership, which I think is a core part of being a manager, but it's not specific, I think that I actually don't think it's about the professional background. I think we have to put in place the right professional structures so that everybody has, so every nurse in this organisation must be very clear on their professional line of support and management. But actually, to manage a team, I don't believe you need to be a nurse. What we need to create in our way of working together, because they're just, we've the best work I see being created is when teams are very diverse. The thing is about respecting the diversity and listening and acting on it. So we need to create a culture where professional voices are heard, and not just asked for an opinion ad hoc, and people co-create decisions and how we move forward. So I think it's about the skill set that as an individual a manager has, the support we wrap around that manager, and the team that sits around that manager, and whether they're a nurse, whether they're from a background in finance, whether they're from a background in business. I think if they're given the right support and have the right team around them, and they have the right values and behaviours, then they make then the managerial performance is excellent. So that would be my response to that. In regards to the comment around the future looks bleak, I recognise that it's really, really difficult just now. And one of the things is, how can you give hope when actually the pressure just seems relentless? I do think that it feels so tough that the opportunity is, we can't pretend that this is working anymore, and we need to significantly change. And if I assume this colleague is a nurse, I'll just bring June on how kind of ambitious June and our nurse leaders are being in regards to what change needs to look like. So I think the opportunity, and I'm not taking away from how difficult it is. In fact, I think about it every day, and try to keep myself really grounded in that. But the opportunity is, I think if we hadn't had the pandemic and the pressure that we've had, we could have gone on for another 10 years in the hope that our healthcare system was sustainable. And I think this past 2 years has shown us that without significant change, it's not. But June, do you have anything you could come in with just in regards to that last bit to finish up?
Yeah, and I think I recently had an away day with our NMAP senior leaders across the system, and we were really looking at our NMAP strategy. We've had the strategy for about 3 years in place, and it's due to be renewed and refreshed. And we did a whole piece of work doing that. And then when we got everybody in the room, we realised we needed to do something different. And the positivity in that room was really quite palatable, to be honest. And it really gave me a whole bunch of energy that I didn't have going in, I can assure you, really to drive what we need to do forward. Some real positivity about how we work with Plan for the Future and what our NMAP contribution to that will be. And it felt really, really positive. Now we need to do a bit of work to shape that, and then start to share it out wider with our other NMAP colleagues to ensure that it feels right for them as well. But yeah, it certainly gave us hope, certainly.
Thank you. And I think with a little bit of hope, that's a good way to end today's session. Thank you very much, June, for joining us. I know you weren't particularly looking forward to this, but you did really well. So thank you for your time. And I'm sure people appreciate you being here. And I'd just like to reassure people that have been in touch over the last week or so, that have asked a number of questions on other topics, that Caroline and I will do another session, hopefully in the next week or so, to get some of those addressed. I know some people had been in touch to say, will my question be asked? Just for people's awareness, I don't generally filter the questions. I do try and put them all to Caroline. The only exception is if I happen to know the answer and can direct that to the right person first. So we will get to all of the questions. But anyway, unless anybody else has anything they would like to add, I will call it a day there. And thank you very much.
Thanks, Mike.
Thank you.
Thanks, June.